Across the country, unvaccinated people have to fight against mandates for their basic freedoms, not just in Canada, but in our nation. But our next guest is a doctor following the science who says the mandates are no longer necessary. Dr. Joel Zinberg joins us now. Dr. Zinberg, you wrote about this in your op-ed. What brought you to that conclusion?
Well, the reality is that we've justified mandates for two reasons primarily. One was we wanted to protect other people on the theory that even if unvaccinated people are willing to risk their own lives, they shouldn't be able to pose a risk to others by getting infected and infecting someone else. And secondly, there was a concern that if you had large numbers of COVID patients, you could overwhelm the health system. And the reality is that those justifications have largely disappeared because of the evolving pandemic and because we're now in the age of Omicron. So what you've seen is that while vaccines were very effective at interrupting transmission at the outset, with each successive wave of variants, they've become less effective, and with Omicron, the effectiveness is quite low. Secondly, this whole need to flatten the curve has largely disappeared. The percent capacity of ICU beds is basically within the sort of normal range that we saw before the pandemic. You have falling COVID hospitalizations in all 50 states. And with the exception of a few local hospitals, they're neither at capacity nor even, close or exceeding it. And finally, it doesn't make a whole lot of sense to impose mandates in a population that's highly protected because of vaccine immunity or because of natural immunity that results from the recovery from COVID. So I think it's really time to reconsider these mandates before you start firing essential workers like policemen, firemen, and teachers.
Who, by the way, we're the first ones, we're the ones who were told you got to work anyway. We don't even know what this pandemic is from. We don't know how it started. We have no vaccine. We have no therapeutics. Just keep working. Stop asking. Now that we have all those things, we say, oh, if you don't get vaccinated, you're fired. And they're doing it by the thousands. 4,000 could lose their jobs this week. Firefighters, too. We know how many nurses are watching us at home right now. And they're needed in hospitals, but can't because they're not vaccinated, even though they have natural immunity. You mentioned, too, about emergency rooms. I wouldn't know this because I'm not in the medical field. But normally, emergency rooms are between 57 and 82% full. That's a successful hospital. So when people say you're almost up to capacity, yeah, that's called Monday. That's called every day. And right now, only 18% of New York hospital beds have COVID patients in them. Doctor, when do we get politicians out of this and let the medical community speak for what practically is the right thing to do? Final thought?
Well, the reality is that the politicians have unfortunately not really followed the science terribly closely. There's been a lot of posing and theatrics, and I think they now have to just look at what the facts are. And the facts are that we don't have a situation where the vaccines are really accomplishing what they're supposed to be doing. So they have to reconsider this. And they're just going to make things worse by having essential workers be out of work and unable to care for the people that they're supposed to be caring for.
I hope people are listening to you. A medical professional, not talking politics, talking being practical. And we need some help in these hospitals and these doctors' offices. Doctor, thanks so much for your perspective.